Hey everybody, this is Dr. Bailey. Just thought I'd do a quick video about sham surgery. Most of my students are very against it and think that it's completely unethical, so I thought I would at least try to argue the other side a little bit. I think we all understand the risks involved, which is, of course, you're being deceitful, you're telling people that you're doing something to their body when you're not. But I'm not so sure many of my students understand the benefits. That's why I thought I would kind of go over this risk-benefit analysis. And to be clear, I'm not advocating that all sham surgeries are ethical or should always be done, but it's kind of surprises me how many students don't even consider why you might even do a sham surgery. So we have to start by talking about the difference between a control group and a placebo group. In a control group, you don't do anything. So you do some intervention to some people and you don't to the other. That's our control group. And you hope that the intervention is better. So here's some hypothetical data where in the pretest, the intervention group and the control group are about equal. Let's say this is a graph of pain, how many pain symptoms a person might have. You give some people an intervention and their pain goes down from, say, a 7 to a 3. And the control group, of course, who didn't get anything is likely to remain the same. So you say, oh, okay, this intervention must be successful. So in control group, you don't do anything, but the problem is that you're not sure if the pain went down for the intervention group because of the actual medicine or the procedure, the acupuncture, the surgery, whatever intervention you did, you don't know if that's what caused the reduction or if it was just the belief in the procedure, if the mind somehow was able to lower the pain just because they believed that something was going to happen. So then you might want to add a placebo group. That means 3 groups, right? A intervention group, a control group, then also a placebo group. And again, in this made-up data, if this were the case, the pretests are all the same, but in the post-test, the intervention group and the placebo group are about the same, you wouldn't have much faith that the intervention was worth doing at all. This is why we do placebo-controlled double-blind studies, is the power of the mind to, for example, lower depression, anxiety, dizziness, pain. Many of these more psychological symptoms are very likely to be affected by our belief system, sometimes as much or more than any actual drug or procedure. So most people get that for the placebo, but for whatever reason, when we think about surgery, we don't have that same belief that it's important to do a placebo-controlled study. So for the drugs, the FDA approval requires that you show that any new drug you come up with is better than placebo, right? It actually does more than just trick the mind into having some reaction. But we don't have FDA approval for surgeries. So most surgeries are done because somebody invented it and somebody said, I bet this is helpful. And just like with our control group, a lot of the surgeries are better than the controls. So we've done them sometimes for hundreds of years. But there's never been a study to actually show, is it due to the surgery itself, or is it due to our belief that the surgery must be helpful? So that's one of my big points I wanted to make, is that we're not really sure about the power of the mind. In one study, for example, they found that pacemakers were helpful to people. They did the surgery, they put in a pacemaker, they asked people how they felt, and they felt better, and then they realized, oh, we haven't turned the pacemaker on yet. So it was a study in 2004 in the American Journal of Cardiology that demonstrated they actually decided to start looking at that, since so many people reported that they felt better after the pacemaker was put in, implanted into their hearts. So many people felt better before it was actually initiated. They didn't actually turn on the pacemaker, that they did a sham surgery in effect, and found that, yeah, it didn't really matter if the pacemaker was turned on or not. And those surgeries, by the way, hundreds of thousands of people have been given pacemakers over the last few decades. I should also point out that since 2004, we continue to do pacemaker surgeries. I think, for most of the people, it's probably just placebo effect, but we still do it. So even if we do a sham surgery and find that a particular procedure is not needed, it's probably still going to go on. It's just interesting to find out that it might not be needed. So the public opinion is very mixed. Most people are in favor of placebo when it comes to pills, but very against sham surgery. There's just the word sham, of course, sounds horrible. And most of my students, advocate against it and just say, oh, that's just so horrible. Why would you ever do that? When in fact, I think most people get the importance of finding out, is there any reason we should be doing this surgery in the first place? One of the reasons I think that we don't like the sham surgery is that we can picture ourselves going through a needless procedure, and it just sounds so invasive and so wrong. But taking a pill that you didn't need to take a pill, if there's no effect, we kind of think, oh, it's not as big of a deal. And I would agree, the risks are much greater, right? They're literally giving people anesthesia without doing a procedure, or cutting into somebody's knee and pretending to do knee surgery was another big study. And back surgery, they've done a few sham surgeries to demonstrate, by the way, that the knee surgery and back surgery might not be necessary. But absolutely, the participants who did it, who actually went through it and thought that they got the surgery, were misled, right? And told that something happened when it didn't. So we picture that anecdote, the power of anecdotes are extremely powerful, and we think about those poor people. I should point out, by the way, that these are volunteers for a study, and they're told they could be put into the sham surgery group. I don't know if that's helpful or not. There's still some deceit, right? Because they don't tell them if they were. Sometimes for a year, maybe 2 years after the surgery, then they say, oh, by the way, you didn't really get knee surgery. You were in our placebo group, essentially. But for the most part, I don't know if a lot of people realize that you would never do sham surgery with somebody who didn't volunteer for a study. So maybe that helps a little with the ethics of it, but it certainly is a more invasive procedure. But I also wanted to mention we have this thing called the action bias. We tend to think you should be doing something. If somebody's in pain, then a medical professional should intervene. We forget, for example, that most pain goes away on its own. Most of the time when you take a pain medication, ibuprofen or whatever, I don't know about most of the time, but there's a lot of the time where the pain went away only because it was about to go away anyway, and the ibuprofen wasn't needed. Even when people know that, they're still likely to take the ibuprofen the next time for a number of reasons, classical conditioning being one, but another being just the idea of, well, I should do something. I'm in pain right now. I should be doing something about it. So surgeons have this same action bias. Obviously, doctors, they're trained to do things, and the idea of not doing something doesn't really come to mind. Again, I'm not advocating that we always consider this and we always hold back action. Sometimes it is needed, absolutely, but we don't really have studies for many types of surgery, and I find that fascinating. So what are the benefits? This is the question on the quiz, by the way, that I hope you get. And if you just answer this first one of the benefits of sham surgery would be finding out that the surgery is not needed, that we have a medical procedure, a type of surgery that is not helpful to people. We would eliminate millions of unnecessary medical procedures. So, for example, knee surgery has been found to be no better than sham surgery. Certain types of knee surgery, I should point out, not all knee surgeries. Same with back surgery. There's a small number of sham surgery studies that have demonstrated that we don't really have any benefit to a particular surgery. I'm not saying that means we'd never do it again. Like I mentioned, we still do knee surgeries, even though it's been shown to be unhelpful. But to me, this is a gigantic benefit. This is immense. Millions of dollars on unnecessary procedures, anesthesia, cutting people open for procedures that don't have any benefit. That, to me, that's a tremendous benefit. And again, I'm not saying we should always do sham surgeries then to find them all out, but the fact that we don't do many sham surgeries at all, it just surprises me. And I think it's because of public opinion. Another one, of course, is to determine which particular surgery is the most beneficial. So you might have surgery that has 10 parts to it, and you just do a sham surgery on part 7, right? So that they get most of the surgical procedure, but just you tweak it a little bit to find out which is the most beneficial part. Essentially, they do this already, where they change the surgery protocol a little bit and see if it helped or not. That's not necessarily a sham surgery study, but you get my point. Is one of our goals is simply to find out what are the best ways of doing anything, and that could include telling participants that something was done when it wasn't, to see if that mattered. And then finally, of course, we just don't really understand why the mind works this way, why we're able to feel that our knees are better even though there was no knee surgery, or our backs feel better after fake back surgery, or why a pacemaker works even when it's not turned on. We don't really understand it. So, I mean, some of the studies could just be to find out more about this placebo effect, because it really is amazing and pretty powerful. Those are just three benefits that come off the top of my head, by the way. They're not the only ones, but to me, the first one is the biggest. There's about 3,000 different surgical procedures. Most have never been tested to see if they're helpful. They've been tested against a control group, often, sometimes, not always even. But there's only been actually 53 sham surgery studies out of these 3,000. By the way, most of those have found that there's no benefit to the actual doing of the surgery. Again, when people hear sham surgery, they think of an individual. They think of one person who was told they got knee surgery and they didn't. And they think, oh, that's horrible, that's unethical. But if you look at the big picture, we had hundreds of people in a study, and over 2 years, you compare two groups of people who actually got the surgery and people who didn't, and find out that the surgery was unnecessary. It changes the whole game, because then millions of people could be affected in the future about whether or not you do that surgery in the future. So yes, 50 people in a study, maybe 100 people in a study got sacrificed themselves for the good of science, and again, volunteered for a study. To me, sometimes, not always, but sometimes those benefits might outweigh that particular risk. By the way, we just had tens of thousands of people volunteer to be a part of a COVID vaccination study, where they were given a pill or given a shot, in this case, I guess, and told you may or may not have gotten the actual vaccine, and we're just going to sit around and wait a couple months and see if you get COVID. And that's why we know the vaccines are effective. We had people sacrifice themselves. We're not told whether or not they were in which group until after they found out that they actually got COVID or not. And that's how we found out that these vaccines are 95% effective, because almost everybody in the placebo group got COVID, compared to almost nobody in the actual COVID vaccine group. Obviously, when I say targeted research, I would say we don't need to do all 3,000 surgical procedures. We should only do the ones that we know are already high-risk surgeries. We're not totally sure they're very effective, and maybe the surgery has huge side effects. So if we can eliminate something that's already dangerous by finding out that it's not all that helpful, to me, that's a tremendous benefit. Some of these surgical procedures you can't do in a sham surgery, like you can't do an amputation study and tell people, oh, we amputated your arm, and then, oh, they're in the sham group, right? And you pretend that you amputate your arm. Right? So there's some studies that just cannot be done. And there's others that shouldn't be done for ethical reasons. But there's a few, and I think the ones they've done so far, they've picked the ones that are already questionable. That's why they tend to find that they're not all that helpful. Back surgery, for example, the idea that you should put cement into your vertebrae to kind of hold your back straight. A lot of people had questions on whether or not that was a good way to do it. And when they did the sham surgery study to show, oh, guess what? The people who thought they got cement put in their backs did just as well as the people who actually got cement put in their backs. Now you could still decide to get that surgery, and some people still do it, but we've found that it's not all that helpful. I did want, normally in class, I show this 6-minute video of knee surgery, which I find very fascinating, because the doctor himself, wasn't really interested in the placebo when he was in training, but felt like, oh, you really should find out, is this a helpful surgery or not? And then this second one is just a nice, 1-page, kind of maybe 2 pages long overview of the different ethical considerations. So just wanted to share that. I think this is an interesting topic, and I hope people consider. You should at least know, for example, on the quiz, what is a benefit? Why are sham surgeries done at all? So feel free to post your reactions, and hope to talk to you soon.